Stick out your tongue. Let me see what's going on. Doctor always makes you do it, right? Stick out your tongue. Say ah. Well, it turns out your tongue is a good indicator of exactly what the inside of your body is like. In other words, your tongue is a good indicator as to whether or not you're in good health, bad health, or even worse, poor health. We know this now because there's been research done on this, and we know this now because there are people speaking out about it, about how the tongue is a very basic indication as to whether or not you're healthy. One of those people is standing by to join us right now. Janine Stiene is a speech-language pathologist, and she has founded the Spot Pal. The Spot Pal. We'll find out about that as well. And for the moment, Janine Stiene, how are you on this glorious Saturday?
I am doing very well. How are you doing?
Well, let me have you tell me. Here, I'm going to stick out my tongue. How am I doing, Janine?
You're doing great. I have a perfect visual of what it looks like. I can tell you where your health is leading.
I know, because you speech-language pathologist, you know everything. No, seriously, I mean, it's always been an indicator. My guess it probably goes back well beyond when I came on this earth, but it goes back centuries when doctors said, stick out your tongue, because even back then they knew you could tell if there was something wrong inside you, right?
Absolutely. And I feel in the last few years, we're definitely seeing more of an emphasis on not only doctors, but rehabilitative professionals taking, and I should say even the dental professionals, taking the tongue, its appearance, and how it's sitting in the mouth a little more seriously than we may have 5 or 6 years back.
It must be one of the more sensitive organs in the body, right? Because you first of all, you have taste buds throughout. Also, this is all, we just talked about how it could be indicative of something going on with you. I view the tongue as an organ. I don't know if you do, but if you do, I would imagine it has to be one of the more sensitive organs in the body.
It definitely is. And it also goes through the same level of development and evolving as you age and mature, especially during those early infancy years, where we start to see the taste buds starting to develop, and we start to see an individual's gag reflex decrease significantly. And then just some individuals' overall ability to tolerate certain textures and consistencies. So all of those, if there's an issue with any of those areas, then we look at the tongue and we can say, okay, if these issues persist, then that means your tongue is delayed in terms of its development, so to speak, and that's where remediation for someone like myself as a speech-language pathologist would be necessary.
A pink tongue, is that, I mean, if you have a pink tongue, everything's okay, or at least it's indicating that everything's okay in your body, or is that just a myth?
Absolutely. So, again, it's all a matter of perception. So a pink tongue is quote unquote normal, but if the tongue is too pink or too red, that can indicate infection or an allergy to something you ate. So again, it's also being cognizant of what your tongue looks like on a regular basis so that you can see those variations and make sure that you're addressing them accordingly.
What about that white coating that some people have on their tongues? You know, that like white filmed coating on that. What does that mean?
Yes. So when you have a white coating on your tongue, I mean, when I was young, my mom thought I told a lie. She would, tell me to stick out my tongue, and if it had white on it, it meant, that I was lying. That is definitely not the case.
You had one of those too. You had a mom like that too. My gosh, they must have gone to the same church.
I did. If it wasn't that, my nose was growing. So I spent a lot of time in front of the mirror. But definitely, it can indicate when you have those white patches, it could be a sign of something called thrush, which is a fungal infection. It could be signs of other bacteria that are in your mouth or other disorders. So if you're seeing some white on your tongue on a regular basis, it doesn't mean you're a pathological liar. It means you should probably have it assessed by a dentist or a dental professional.
I know this has nothing to do with speech pathology, But I was always told you should brush the tip of your tongue when you're brushing your teeth. Is there anything to that?
Absolutely. You actually should brush your entire tongue when you're brushing your teeth. Depending on the texture and consistency of an individual's tongue, sometimes it has really deep grooves or ridges, and bacteria will get stuck in there. So you definitely want to always brush the tongue and make sure it becomes part of your routine. But the one thing that I will say is that most individuals think they should brush their tongue and they brush it forward, almost like it's coming out of their mouth. And actually, from a speech pathology perspective, and even just from the muscle of the tongue perspective, it's better to brush it backwards because you want to kind of tell the tongue your home is in the mouth, not the other way around. So do the same thing, but just brush it in the opposite way.
Just brush it in the opposite directions. Well, obviously, Gene Simmons of KISS brushed his tongue forward because the average tongue is 4 inches in length, and his is like 8.5. So, I mean, you know what I'm talking about? Gene Simmons and KISS? Yeah, it's unbelievable.
I do.
Yeah.
It's actually a little scary, that picture.
No, it is. No, he's frightening. I would, if I was near him, I'd run or cover myself in some sort of lacquer. So Spot Pal, Spot Pal, that's your thing. It's an innovative company that you founded, Janine Stiene. What is Spot Pal? What is that all about?
So Spot Pal is the first ever tongue training appliance worldwide, and we've just recently got our patent in the last year, and our goal is to take into account the purposes of the tongue and intervene to make the tongue do what it should be doing as soon as possible. Because the tongue is such a strong muscle, it has such a negative impact on the bone of your mouth, like the top of your mouth, the roof of your palate, and it can change the shape of your face. Oh. So the Spot Pal is designed to be a customized appliance that we can work on habituating proper tongue posture and maximizing what that patient or individual should be looking like because we're putting the tongue where it needs to be.
Well, okay, so people aren't putting their tongues where they need to be. With what are they doing? What is a tongue doing that it's not supposed to be doing? I mean, you know, the stuff we can talk about on radio. What is it doing that it's not supposed to be doing, Janine?
So what's happening is, in the very layman's terms, we are all born as infants as a tongue thrusters, and that's how we swallow. So we often see when you give a baby cereal for the first time, more food comes out of their mouth than goes in their mouth. That's called a tongue thrust. But you should outgrow that tongue thrust, usually early toddlerhood. Majority of people are not outgrowing that tongue thrust, so their tongue is sitting too far forward in their mouth, and it's having to use all these compensatory strategies. When you utilize those compensatory strategies, it leads to things like temporomandibular joint disorder, it leads to sleep disordered breathing, it leads to articulation difficulties, and then it also addresses or issues the structures of the mouth, the shape of the face, the shape of the lips. So our goal is really to intervene early and teach those skills so that the body can grow and evolve in the proper way.
So is this like a device you wear at night? You stick in it at night or whatever, or how does it work?
So what it does is we take a scan or an impression of the mouth, and we make an appliance that, yes, you're going to wear it up to 2 hours a day. If we're working on something like an individual with sleep disordered breathing, then yes, they would be wearing it at night. If we want to work on their tongue sitting in the proper position, which is up behind the front teeth, but not touching those front teeth, it has a spot on the device itself that shows the tongue where it needs to be and where the tongue can place. And then on the back of the teeth, it has little spikes. And those little spikes are designed to deter the tongue so that it's not pushing forward and moving the teeth, thus requiring braces or changing the shape of the face, but also sitting in that proper place so that it opens the airway and leads to less sleep disordered breathing.
Wow. Well, I hope everybody is checking their tongues. Yeah, it sounded up until the part that you talked about little spikes on the back of it. It sounded like it was a good deal. Then you got all medieval on us, I think, there with the spikes in the back of your mouth. But no, I'm sure it works. I'm just yeah, no. So I hope people are checking their tongues as we speak, and maybe that'd be good because the only people speaking should be you and me. But I hope they're checking their tongues as they speak. And Spot Pal, I mean, if somebody thinks they've got a problem, what do? Who do they go to first? Their dentist? They go to you? Who do they go to?
They can go right to our website, thespotpal.com, and they can take the questionnaire of whether or not they fit into someone that would require or benefit from a Spot Pal. And then one of our staff will reach out to them and make sure we can customize it specifically to them and their needs.
All right, Janine Stiene, this is good stuff. And everybody needs to stick their tongue out and say, ah, and when you brush it forward. I hope you do well with that, and thank you so much for your time. We appreciate it.
Oh, I appreciate you having me. Thank you so much. Enjoy the rest of this beautiful day.
There she is, Janine Stiene, the Spot Pal. You got white coating on your tongue? Well, I mean, it does match green teeth. So you got that going for you. It's 150 News Radio 700 WLW.